Today I'm going to explore the psychological factors in older patients at risk of falling in the Thanet area. The World Health Organization defines a fall as an event which results in a person coming to rest inadvertently on the ground. Worldwide, falls require medical attention 37.3 million times each year, accumulating to second leading cause of accidental death caused by injury, of which older individuals are at higher risk of. Thanet has a high population of older people. In 2016, it was estimated that 23.1% of Thanet's population were older than 65. For every 100,000 hospital admissions, 472 were falls related in 2012. This too is higher than the average for Kent. Between 2008 and 2012, falls in Thanet increased by 50%. During one placement shift, I visited a gentleman who had fallen. After investigation, it was apparent that he required further assistance at the hospital. The gentleman was scared even to sit up, let alone stand. He had an immense fear of falling, regardless of the reassurance and guidance that we gave him. This showed me the immediate negative effects that this man's fall had had on his confidence and ability to mobilise without fear. Any number of factors could contribute to an individual falling. This could be environmental, such as loose rugs or trip hazards, or falls could also result from medical causes such as loss of consciousness, medications, or as a warning sign of further deterioration of health, such as a UTI or an infection. In this case, investigations led us to believe that this gentleman had a UTI. We were also querying sepsis, which resulted in a treatment approach differing from one that we would have taken if it simply tripped over a rug or door frame. Therefore, our treatment plan involved administering IV fluids and paracetamol, carrying out an ash ice and transporting him to hospital. Later, a vulnerable person's form and falls referral form were completed. If the patient was presenting differently, the treatment plan and the use of medical interventions would have changed in accordance with our impression. Research has demonstrated that behavioural aspects associated with the fear of falling affect the individual. The fear of falling can initiate what is known as the stiffening strategy. This occurs when the individual's body adapts to a reduced range of movement. When this occurs, the individual is in fact at a greater risk of overbalancing, tripping, or falling. This demonstrates how the psychological effect of being frightened of falling can further result in a greater likelihood of having a fall. This was demonstrated in the case of the elderly gentleman that I visited. Previous falls had left him fearful. Whilst assisting the gentleman, I could see that his fear had massively increased, especially when he needed to be moved to the ambulance. Adopting a fear of falling can have further repercussions, which can later affect an individual's mental health and well-being. If an individual is worried about falling, their day-to-day habits will decrease and trips out can become infrequent. This can result in social isolation and the feelings of loneliness. Being lonely can have further effects on individuals. It can negatively affect blood pressure, reducing health. If an individual is fearful of going out, this can further reduce visits to the doctors, resulting in the neglecting of their health, which can result in an increased poor health in general. Loneliness also has a strong link to depression. These two factors are associated with high mortality rates and have a negative impact on social isolation. Studies researching links between low income and fall risk have shown a correlation between lower income groups and a greater risk of falling. One study found that factors such as stroke, visual disturbances, the use of assistive devices, diabetes and depression were all common in low income groups, and as a repercussion, these individuals were at a higher risk of falling on a whole. The first pathway that can be used to preventing future falls is by completing a falls referral. This can be done by the ambulance crew. It makes the patient known to social services and then they can further assess the patient from there. This can be done through the iPad software called IBIS. In the first week after the launch of IBIS, falls referrals tripled, showing that the pathway was easy to use and more individuals were getting the help that they needed. This is the initial pathway that was taken with the patient I visited, as he did not have a care package in place. An additional pathway that could be taken is to refer the individual onto Age-UK. Individuals can undertake exercise programs which are designed to improve balance and strength, which in turn will help prevent falls, as well as the individual being socialised with others, their age group. This can boost their well-being. The National Institute for Health and Care Excellence provides guidance stating that older people who require medical intervention due to a single fall or recurrent falls should be offered a multifactorial risk assessment. The falls referral regarding the patient that I visited on placement would have this initial process. The assessment allows the team to determine any requirements that the patient may have to ensure that they are safe and comfortable at home. Furthermore, NICE have produced a flowchart offering step-by-step pathways for the prevention of falls. Overall, falls are a serious issue and should be dealt with properly using the appropriate guidance and pathways to avoid further detrimental effects to the patient's health and well-being. Thank you for watching, and here are my references.